Today, as part of ISO MVR CanCon 2024, we have with us Professor Guido Torzilli, who is the Director of Surgery Services in Humanitas and the Professor of Hepatobiliary in Humanitas Hospital, Milan. And we're very happy to have with us and share his thoughts about his concept of the anarchist concept of hepatobiliary surgery. And the first question I would like to ask, sir, is do you think versatility in diagnostic ultrasound is an essential part of a surgeon's training?
In general, I think so. In general surgery, not only for the liver. In emergency is fundamental. In the patient care, perioperatively is fundamental, bedside. So the ultrasound is in reality the real stethoscope, the modern stethoscope. And in this sense, I think that is a fundamental, especially for the surgeon, who for him there is her, a practical aspect which is very important, and in the OR is the absolute protagonist, especially for an organ like the liver, which is not transparent. It makes transparent an organ which is featured by high complexity, high vascular complexity, difficult anatomy, huge organ, with nearby the heart, the major vessel surrounding the inferior vena cava. So it's quite important to have a guidance and to proceed safely to remove the disease, and the ultrasound allow the surgeon to remove selectively the disease rather than just amputating the organ with a gross approach that is featured by the side in which the tumor is, and you amputate. This is deprivating the patient of a part of function of the organ for a while, or definitely, unfortunately, sometimes. And we should avoid that, and it's possible to do that thanking to the introduction of the ultrasound.
I think those three things which you just mentioned about radical but conservative, and the ultrasound being an extension of a surgeon's hand or his vision and acting like a stethoscope for the surgeon, are two important take home messages from your talk, which was delivered earlier for CanCon 2024. Another question which I think is holding resonance with people in India would be the concept of EOSH is more applicable in a resource limited country like India, because we do not have a lot of resources where we can spare it for transplant. So with this extensive liver metastasis, I think it would be a
organ donation is also a challenge.
challenge.
So for cancers, no organ donation. So
Well, I think that the use of the ultrasound in liver surgery facilitate the procedure for sure. Is indispensable in my perspective. It's growing in terms of cultural background of the surgeon that is able at this point to manage the imaging modalities better, and is fundamental for driving the resection and selecting procedures that are more conservative. Then it facilitates even the easier procedures, so one lesion, but moreover is boosting the approach to the high complexity. So when you have a lot of disease within the organ, within the liver, facilitating solution that otherwise would be impossible and are alternative to the major hepatectomy, or even nowadays the transplant is not the alternative. Up to now is still for the unresectable. In future, it will be also for sure for the resectable, but the organ donation is limited. Then, this space should be occupied by ultrasound-guided surgery. Paradoxically, the ultrasound-guided surgery is popular in the Far East. Now is becoming, in Italy it is, and it is becoming popular in Europe, but in the Anglo-Saxon world is less popular. and now is becoming also there. And if it grows the culture of the parenchyma sparing, the guidance with ultrasound, probably it will be displaced also the role of the major amputation of the organ. It will be increased the panel of the patient that can be operated, and it will be a safer procedure for the patient. The problem is that the procedure is longer than the other, despite you have to take into account that this patient would have been operated with the stage procedure, which means 2 operations, not 1 operation, while you in 1 operation longer perhaps, but only 1 operation. So the risk is lower and the potentiality wider. I mean, I think that there is no discussion in this sense. It's a win-win solution. And you are right, because if there is an economical constraint, there is only the ultrasound or whatever. We have to consider that also there is the perioperative management, and the perioperative management of high complexity, somehow it costs, whatever, wherever you. But in this sense, I could say also that if you follow the recommendation and the operation is done in a proper manner with enough liver and expert anesthesiologist, and of course adequate surgical team, is a procedure with low mortality, very low, below 1%, safer than the stage procedure and the transplant, of course, and even low major morbidity. So in terms of postoperative care, the patient is fed the day after, and in 7-8 days go back home.
So in short, the ultrasound being a very cheap alternative to transplant, the paucity of organs for cancer, all this will add up to the popularity of the USG guided surgery of liver. And Dr. Deepak, who had he was lucky enough to visit Humanitas Center, where you are the director of surgery as well as the professor of hepatobiliary services. So in this, he witnessed a lot of surgeries and you have taken as much as 83 tumors from the liver. So that itself is testament to your work, where that liver would have gone for a transplant otherwise. So Dr. Deepak, your comments?
I'm saying, yes, you have opened up ideas, and I think you have to ignite more minds from our part of the country. You have opened up surgeons, because young minds want to do things, but there are challenges. Post-operative care is a challenge. Post-op, if they venture on to major resections, post-operative, the economy, the surgery can cost a certain amount, but if there is post-op liver failure, that part can be detrimental to a starting surgeon. So,
Well,
the system has to be there. The system has to be in place. So it will take time. I know you have. I just want your journey, like for being a very radical liver surgeon. What is the time you require to develop a department where your mortality and morbidity you could bring down?
What was your learning curve?
More than the parallel departments, the anesthesia, and to bring them all, being aware of this ultrasound as a technique, to make them patient. The anesthetist has to be patient with the surgeon, doing all the ultrasound 10 times, removing it. I've seen you, how dedicatedly your students come at, but the anesthetists are also involved in the procedure. We have to make the group also convinced that. So
but it depends on several factors. There is not a rule. If everyone is moving in the same direction, and every group and team is motivated enough and open-minded, which means that everyone has to step down a little bit from his control power to leave time and attention to the exchange of the opinion. If so, and if everyone is motivated in getting deep in this direction, I think it's not so long time consuming. I mean, there should be some guys that has been trained elsewhere, and then maybe also the anesthesiologist, and coming back, they have to be wisdom enough to not be selfish. The secret of success is to transmit everything you have learned and to rely in the team, in the teamwork. And the people that you select in the teamwork has to have the same mentality. So the question is the human being has to be open-minded, available to and enthusiastically joining a teamwork. So a little bit step down your individualistic aspect. And also the different culture of the intensive care and anesthesiologist and the surgeon has to merge. The anesthesiologist has to understand, and in my example, it took a lot of time.
Yeah, that's what
Why? But because the environment was not ready, because my power was not enough, because there were political reasons, a lot of enviness and whatever. This is the usual existence, and these are the real time-consuming worst aspect. For once if there is not or these aspects are minimal, and there is enthusiasm and willingness, the younger will be involved spontaneously. And you have to start a modality that if everyone agree, it is quite fast. The real motivation for which could not proceed is an example. The management of the hospital, they are not in line with your enthusiastic purpose, and they are not clear saying yes or no. Maybe is not good. Maybe should not be. You cannot start with maybe as an answer. Maybe we will donate the ultrasound. Maybe you will have the OR. No. So everyone has to move. If everyone is moving in this direction, and there is the competence exists from 1, 2, 3 person in the key position, and you have enthusiasm of young, all of my staff has grown up with me. No, I was, of course, I'm the senior, but it's like I'm the father or the old brother, of all of them. And this is a very important aspect because there is a linkage. And the linkage in a team, surgical team, also with the anesthesiology is fundamental. You don't need to speak. Everyone understands the other. And this is the reality. Technically, it's a surgery. This is surgery. There is nothing special. Special is only the different approach, which is original, but motivated by what I learned in Japan. It's not my. Everything is coming from the brain of Professor Makuchi, the real inventor of everything, to whom I am a devoted pupil. Devoted, absolutely. Without him, I couldn't be what I am. And also, this is important. Every one of us has to recall from where he is coming to keep the
Feet on the ground.
feet on the ground. Otherwise, and it's better if you have a surgeon, a doctor that who is not walking on the ground, the patient should stand and go away immediately.
So to sum up, we have Dr. Guido Torzilli, who is a maverick surgeon who has pioneered the use of ultrasound to remove the maximum number of liver metastasis, that is tumors in the liver, with the help of ultrasound guidance. And this technique of his, which he has pioneered with his guru Professor Makuchi from Japan, and he is kind enough to present his topic in MVR. So, in a country like India, where the number of people with liver metastasis is going to increase, and where transplant is not going to be an option for everybody, this technique can be used and applied where the economic issue is also not very high. So I would like to thank Dr. Guido Torzilli from MVR side for coming all the way to India. This is his fourth visit to India, and I hope he has had a
Few words
good
about Kerala and
few words about Kerala, and probably you've had only a few short time here to actually experience Kerala, but a few words about Kerala.
I am very pleased to be here. I experienced most of my time in the meeting, but I had the chance to see the beauty of the country,
And
the
the
nice
hospital.
people that are
How did you
here,
like the hospital?
and the hospital is very nice. I mean, impressive, very nice, very well preserved, very nice, and a lot of good people are there. Of course, no.